What is the new Chinese virus HMPV? How to prevent and be safe? Human metapneumovirus, HMPV, is a respiratory virus that primarily affects the lungs and airways. Though it was first discovered in the Netherlands in 2001, recent attention has focused on an emerging strain of HMPV that is spreading in various regions, including China. This new variant has raised concerns due to its ability to infect a wide range of people and its potential to cause severe illness, particularly in vulnerable populations such as the elderly, infants, and individuals with weakened immune systems. Overview of HMPV. HMPV belongs to the Paramyxoviridae family, which also includes viruses like the respiratory syncytial virus, RSV, and parainfluenza viruses. It is transmitted primarily through respiratory droplets when an infected person coughs or sneezes, or by touching contaminated surfaces and then touching the face. The virus primarily targets the respiratory system, leading to symptoms similar to the common cold or influenza, but it can also cause more serious illnesses like pneumonia and bronchitis in certain individuals. Symptoms of HMPV infection. The symptoms of HMPV infection can vary widely, ranging from mild to severe. Common symptoms include 1. Fever. 2. Coughing. 3. Runny or stuffy nose. 4. Sore throat. 5. Shortness of breath. 6. Wheezing. 7. Fatigue. In more severe cases, especially in young children, the elderly, or immunocompromised individuals, HMPV can lead to more serious respiratory problems like bronchiolitis, pneumonia, and even acute respiratory distress syndrome, ARDS, which may require hospitalization. Spread and transmission. HMPV spreads through respiratory droplets produced when an infected person coughs or sneezes. It can also be transmitted by touching surfaces contaminated with the virus, such as doorknobs, countertops, or other objects, and then touching the face. The virus can survive for several hours on surfaces, making it easier to spread in crowded places like public transport, hospitals, schools, and daycare centers. Emerging concerns. And new strain in China. While HMPV infections are not new, the emergence of a new strain in China has raised concerns due to its increased spread and impact on public health. This new variant may have mutations that allow it to evade some of the immune system's defenses, potentially making it more infectious or more capable of causing severe disease. Additionally, there is concern that the new strain could contribute to a rise in respiratory illnesses during peak flu and cold seasons, adding strain to healthcare systems. Prevention measures. Preventing HMPV infection involves general practices to minimize exposure to respiratory viruses. Key preventive strategies include good hygiene practices. 1. Frequent hand washing. Wash hands regularly with soap and water for at least 20 seconds, especially after coughing, sneezing, or touching potentially contaminated surfaces. 2. Hand sanitizer. Use alcohol-based hand sanitizers when soap and water are not available. 3. Covering coughs and sneezes. Use a tissue or the elbow of your arm to cover your mouth and nose when coughing or sneezing. 3. Dispose of tissues immediately. Avoiding close contact. 1. Stay away from sick people. Avoid close contact with individuals showing symptoms of a cold, flu, or respiratory illness. 2. Social distancing. In areas of active outbreaks, maintaining physical distance, at least 6 feet, from others can reduce the chance of transmission. Wearing masks. 1. Face masks. In crowded or poorly ventilated areas, wearing a mask can help reduce the spread of respiratory droplets and protect against infection. Sanitizing surfaces. 1. Clean common surfaces. Regularly disinfect high-touch surfaces like door handles, smartphones, and countertops, especially in shared environments such as offices and public transportation. Avoiding crowded and poorly ventilated spaces. 1. Proper ventilation. Ensure good airflow in living spaces, schools, offices, and other indoor areas. 1. Open windows and use air filtration systems if possible. Strengthening immune health. 1. Healthy diet and hydration. Eating a balanced diet rich in fruits, vegetables, and whole grains, and staying hydrated can support your immune system. 2. Vaccinations. While there is currently no specific vaccine for HMPV, getting vaccinated against related respiratory viruses like the flu and RSV can reduce the risk of complications. 3. Adequate sleep and exercise. Regular physical activity and sufficient sleep can help strengthen your body's defenses against infections. Treatment for HMPV infection. Currently, there is no specific antiviral treatment for HMPV infections. Treatment typically focuses on managing symptoms. 1. Rest and hydration. Resting and staying hydrated are essential for recovery. 2. Over-the-counter medications. For mild symptoms, over-the-counter medications such as acetaminophen or ibuprofen can help reduce fever and alleviate pain. 3. Oxygen therapy. In severe cases, supplemental oxygen may be needed to support breathing. 4. Hospitalization. Severe cases, especially in vulnerable populations, may require hospitalization and more intensive treatments such as mechanical ventilation. When to seek medical help. If you or someone you know experiences severe symptoms, such as difficulty breathing, persistent high fever, or chest pain, it's important to seek medical attention promptly. Early intervention can help prevent complications and improve outcomes. Conclusion: HMPV, while not a new virus, is gaining attention due to its emerging strain and potential for widespread infection. Preventative measures like practicing good hygiene, avoiding sick individuals, and maintaining proper ventilation can significantly reduce the risk of contracting the virus. By staying informed and taking appropriate steps, individuals can help protect themselves and others from this respiratory illness.